Shedding light on a shadowed topic, the shocking suicide rate among first responders. The CDC says law enforcement and firefighters are more likely to die by suicide than they are in the line of duty. The report states that the stress and uncertainty of their jobs can lead to mental health concerns. WFXR's Anna McDougall joins us live from the Lynchburg Police Station. She talked to a lieutenant about what first responders are dealing with and what resources are there to help them. Anna, what did you learn today?
Good evening. Well, Lieutenant Burgess with the Lynchburg Police Department tells me that they're who people call when they're having some of their worst days. And he says oftentimes these officers end up taking on some of those traumas and stressors that come along with the call of duty. He works closely with a peer support group within the department to encourage anyone who needs mental health support to speak up.
We get into this line of work to help people out in their bad times. If we'll do it for the public, we're going to do it for each other.
Lieutenant Burgess with the Lynchburg Police Department says occupational stressors can have serious effects on mental health. The department works closely with Impact First Responders, a counseling service made to help those who work in the field.
We are absolutely not coming in and telling them how to do their jobs. They already do their jobs well. What we provide is resources for how to do their jobs well and also like their lives.
Burgess adds, however, that mental health awareness in law enforcement was not always like this.
Years and years ago, it was, hey, that was just a bad call for service, suck it up and move on. And now there's a lot more awareness when it comes to mental health.
Former police officer and retired professor of criminal justice, Dr. Todd Burke, spent a portion of his career researching the impact of stress on first responders. His findings show that occupational stressors can lead to burnout, substance abuse issues, family and relationship strains, physical health concerns, PTSD, and depression, and in some cases can even contribute to a death by suicide. He says while resources and advocacy has improved over the years, there is still a long way to go.
There's a stigma attached to getting help because it's shown as a sign of weakness.
He says first responders often don't recognize signs of mental health issues in themselves. Dr. Burke says in those cases, it's important that people around them stay aware.
I think it's up to the duties of police agencies, the police administrators, to seek help for the officer.
Burke says in order to be able to support the community, they need to be able to support themselves.
They're counting on you to be healthy, both physically and mentally.
Now, another thing worth noting is that services with Impact First Responders are completely anonymous. And although they partner with local agencies, any first responder across the Commonwealth can reach out and get help through their services. Live in Lynchburg, Anna McDougall, WFXR News.